When you go to the hospital, you expect to see a doctor and be treated there. But if you're a victim of sexual assault in southern Illinois, that's not always the case. Most local hospitals do not perform sexual assault kits, also known as evidence collection kits. The reason why is not a simple one. Here's my co-anchor, Brooke Schlyer, with a special report.
Well, Mark, throughout the region's 15 counties, 5 out of 14 hospitals offer evidence collection kits, and that's according to the Illinois Department of Public Health. You can see them on this map that's right here beside me. Now, those hospitals are Massac Memorial Hospital, Hardin County General Hospital, SIH Heron Hospital, SIH Memorial Hospital Carbondale, SSM Health Good Samaritan Hospital. Tonight, we share the story of a woman who went to a local hospital wanting an evidence collection kit, only to find out that location did not offer them. We'll also dive into why several hospitals in our region have that policy in place.
I remember him setting it down on the table in front of me, and that's it.
Cheryl Thompson celebrated New Year's Eve like many of us do, out for a few drinks with some friends. For Thompson, a bar down the street from her house in Cobden. When she woke up in the morning, she just knew something wasn't right.
A bunch of dirt, pebbles, leaves, and a little prickly gumball fell out the back of my pants.
Noticing other signs of sexual assault, Thompson then drove to the Union County Hospital, believing she would see a doctor for a rape kit, also called an evidence collection kit. That's not the case.
His response to me was, "We don't do rape kits here. You have to go to Mount Vernon," which is 77 miles away.
Thompson did not feel comfortable making the trip from the Union County Hospital to SSM Health Good Samaritan. She decided against it. Thompson later found out through the Survivors Empowerment Center, SIH Heron Hospital, and SIH Memorial Hospital of Carbondale both perform evidence collection kits.
Instead of telling me I could go 20 minutes from my house or 30 minutes from my house and get a rape kit done, and I would have had all the evidence I would have needed, because I still had on the same clothes. And I hadn't showered, hadn't done anything.
So why did the doctor recommend Thompson travel so far? Through a partnership, Good Samaritan does sexual assault services for the Union County Hospital, plus 6 other hospitals in our region: Hamilton Memorial Hospital, Crossroads Community Hospital, Franklin Hospital, Marshall Browning Hospital, Farrell Hospital, and Heartland Regional. There are several reasons for this: a low volume of sexual assault victims at rural hospitals, hiring and maintaining staffing to carry out evidence collection kits, and the amount of time it takes to complete evidence collection kits. That's according to Sue Drabing, Vice President of Midwest Emergency Department Services. Her company provides SANEs, or sexual assault nurse examiners, to carry out evidence collection kits at Good Samaritan.
A kit entails everything from photo documentation, the victim's statements, clothing, DNA evidence. They can do hair clippings, they can do nail clipping.
On top of a nursing shortage, there's a need for SANEs. Becoming one takes 6 to 12 months of training. Only 25% of nurses who start SANE training finish it. And at the end of 2 years, 50% of them already left the program.
It's a very stressful role. They see a lot of trauma in these victims and hear a lot of horrible events that have occurred.
Hiring SANEs and keeping them is a challenge, especially for rural hospitals.
So your smaller hospitals that see 1 to 4 cases a year, just as an average, that's a small, very small number for hospitals to be able to maintain these nurses.
Damon Harbison, president of Good Samaritan, says evidence collection kits can take anywhere from 6 to 12 hours. Nurses in the emergency room cannot leave the department for that long of a time period, so SANEs are needed.
Now it is reducing the capacity of the emergency department for other patients coming in with other health services needs.
Plus, it's a process that cannot be rushed. SANEs must pay attention to detail while also, of course, showing compassion.
It's an equation where there's so many different variables, and we need to get it right because we only have one chance to help this patient.
So what about other hospitals in our region? The Pinckneyville Community Hospital transfers sexual assault patients to Memorial Hospital in Belleville. Meanwhile, SIH keeps patients within their own group of hospitals. I spoke with Melanie Sanders, System Director for the ER and Patient Logistics at SIH. She says Memorial Hospital of Carbondale does evidence collection kits for St. Joseph Memorial Hospital in Murfreesboro. That's because Illinois state law requires a victim to see a SANE within 90 minutes of reaching a treatment hospital. The two other SIH hospitals have the same agreement.
Harrisburg partners with Heron to be their treatment center, and so we would either arrange transport or have them drive themselves, dependent upon their request.
Katie Gossett is one of 7 full-time SANEs at SIH. She explains even if victims do not want to be transferred, they still talk to a SANE over the phone and get other care.
They still get the medications and they get follow-up and they get an exam, everything the same minus evidence collection. So they're not just dismissed at a transfer facility.
Still, I asked the question, should these victims be given a list of the hospitals in Southern Illinois that carry out evidence collection kits so they can choose where to receive treatment? That way, patients like Thompson can avoid a possible 77-mile drive. Drabing believes all patients should be given options for their care.
When they come into the emergency room and they have a broken leg, or they have chest pain and they need to go for surgery or something, or even the sexual assault in this case, they all should be always given their options of where they can go for care.
However, it's not that simple. A patient can request to be transferred to another hospital, but that hospital does not have to accept the patient.
Each transfer hospital is approved by Illinois Department of Public Health for what they can transfer to where.
Thompson believes that rule by the state needs to be changed.
That puts an undue burden on the victim, and that should not happen. And I'd also like to see our legislators change the law, maybe, if that's even possible.
After Thompson left the Union County Hospital, she went home, changed her clothes, and showered. More than a week later, she went to SIH Memorial Hospital of Carbondale for an evidence collection kit. She fears cleaning herself and the amount of time that passed could hurt the chances for a DNA match and a conviction.
I don't think I'm going to be able to hold him responsible at all.
I reached out to Deaconess Health, who oversees the Union County Hospital, Heartland Regional, and Crossroads Community Hospital. They did not wish to release a statement, but tomorrow we'll look into how many cases of sexual assault our local treatment hospitals do see and break down the number of adults and children that decide to go forward with an evidence collection kit. For now, Mark, back to you.
Thank you, Brooke.